Hello, I'm Eduardo Gallegos from Roscoe Collegiate High School, and today I will be talking to you about neurosurgery and the gamma knife procedure. This isn't really so much as a new procedure, but it was recently introduced. The gamma knife, to give you a little brief history of it, the gamma knife was created by Lars Leaksell, or the father of modern radiosurgery. He was developing it while he was in the university with one of his mentors, and this was in Sweden, by the way. And he developed the gamma knife sometime during that career. So many of you are asking, what is the gamma knife? Well, it's a revolutionary tool that can let you treat a brain tumor without having to make it cut into the skull. That eliminates a lot of risks involved in just cutting into it. And its focus is really small beams of radiation that go into the cells and kill the cells of that tumor. And it's recognized worldwide to be an effective treatment plan for most patients. Some patients can't deal with so much levels of radiation. So they have to do either other treatment plans, or it's deemed inoperable. But the gamma knife can sometimes eliminate otherwise inoperable tumors in the brain. It's little risk factor of any complications, such as just like cutting into the brain, probably bleeding out the brain, or an infection. And there's little discomfort reported by the patients. In fact, the average stay after the procedure is an overnight stay at the hospital, or you're monitored after the procedure. And it usually costs 25 to 30% less, according to the website that I've gotten this information from. So if you're on a budget, this will be a pretty good deal for you. Well, how does the gamma knife work? Well, there's a lot of steps involved in actually using the gamma knife itself. First, the patient has to put on a sort of helmet. I shouldn't say helmet, but it looks like a helmet, and it's a sort of helmet that goes around the head. And then you go under an MRI and or a CT scan, depending on what kind of tumor you have. And from there, as you see on this image over here, the neurosurgeon develops 3D imaging graphs of where the complication is in the tumor. And this one looks like it's on the lower part of the brain, near the brainstem, so it's kind of a serious tumor. And from there, the radiologist and the neurosurgeon make the decisions on if this is treatable or not. Can they use the gamma knife on this? Will there be any risks? And then some of the treatable tumors are metastatic brain tumors. Some of these terms I don't know, so bear with me. Intravenous malformations, those probably have to do with the artery veins in some way. Meningiomas, probably have to do with meningitis and prevent that from happening. Acoustic neuramuses, I have no idea what those are. Pituitary tumors, those are in the pituitary glands of the brain. And other malignant brain tumors. There's a number of brain tumors that the gamma knife has actually helped to treat that would otherwise be inoperable or uncurable. So, in conclusion, this isn't just an experimental type of radiosurgery. This isn't just thought up and done immediately. It was actually implemented, tested, and it's actually worked for several thousands of Americans and several millions of people all over the world. In fact, it has a higher success rate than just cutting into the head and operating. So